Right.
Tell me about breast augmentation, how it's done now, if they're using silicone implants or if they put fat in the area. The breast is fatty tissue, isn't it?
The breast is a combination of fat tissue and breast tissue, so it depends on how much a person has. But the implants now that I use specifically are typically mostly all silicone now. The silicone scare is kind of gone now. It was kind of overblown in my opinion, but the quality of the implants now are better than ever, and their safety profiles are excellent, and I have no fear putting those in.
So when you put in an implant, let's just say on the left side, you put them on both sides, so let's take the left side. Is it come in like a plastic bag with stuff in it?
Yeah, the breast implant itself is actually a silicone shell of the implant, and the internal part of the implant now is silicone gel. So it's all silicone. It comes pre-filled, pre-packaged. You can't adjust the size of that particular implant. So if it's a 400 cc implant, it's a 400 cc implant. And basically you're designing it to fit the breast of that particular patient. You know, you don't want to overdo it and overstretch them and things like that. So I try to do it with their anatomy in mind and some certain measurements I do, and I say I think this is the biggest implant I would ever put in you, for each patient.
So if you took a breast away, you got the rib cage, you've got some muscles over the ribs. Where do you put the silicone implant? Do you put it next to the ribs or between muscles? Where do you put it?
Yeah, there's two different methods of putting an implant in. One is submuscular, below the muscle, or above the muscle. And typically I try to go below the muscle, but even then your pectoralis major muscle, which is this big muscle of the chest, your breast sits on top of that. Behind it's the rib cage. So ribs, muscle, breast. We make an incision typically in the crease, and we begin to get directly underneath that pectoralis major muscle and dissect and make a pocket for the implant. You put the implant in, and in reality, a submuscular or subpectoral implant is only covered by about 50% muscle. So it's this portion of the implant out here on the outer edges is not covered. It's below just the tissue.
Since you've got silicone, I guess the silicone implant, is that what the liquid is, a silicone liquid?
It's really not liquid anymore. It's the implant shell is made from silicone. You can cook it. So when you cook it and you add carbon to it, you can make it into a hard form or a soft form or a liquid form. And the shell is not real hard, but it's hard enough to be a shell. The internal piece now is if I took that implant and cut it in half, it won't leak out anymore. It's like a gummy bear if you think of it that way.
So you can get the texture that's more like normal breast tissue would be.
Sometimes better. It's really nice. It's like if you've ever had a worry ball in your hand and squeezed that worry ball, it's very similar to that feeling. So.